Hello everyone, welcome to Focus on Health. It's always a pleasure having you here with us every Tuesday at 7:30 p.m. when we get down and discuss matters health. Today we're going to talk about ear, nose and throat. And when we talk about this is such a very huge topic, and we have Dr. Josephine from the Bliss Medical Center to just give us a little bit perspective of all this. And of course, you're going to focus on otitis media. For those who don't know, we have the good doctor here with us to just give us a little bit perspective of this. Welcome to the show. Thank you very much, Dr. once again for joining us.
Thank you.
So the first question that I will ask you, somebody back there is asking, we all know about ENT and we know that it's called ear, nose and throat, but from a medical perspective, what does this really mean?
It is a combination of conditions that affect either the ear, the nose and the throat. So you find that these are conditions which in one way or the other may affect each other. So you can find a child with any condition affecting the throat may complicate to a ear condition.
And is that the reason why they have been put together? Because it's very rare that we put in the medical world, we have these things put under one umbrella, like ear, nose and throat. Why can't we just say ear infection, nose infection? Do we have, just as you mentioned, do we have any relation between the three of them? Or is it that they are just next to each other?
One, it's about the anatomy of the three.
Yes.
You find in one way or the other they relate in terms of the anatomy.
Yeah. Thank you very much. So today what is really of importance to us is we are going to discuss about the ear. Yeah, and more precisely otitis media. You told me that depends on where you are English, who or where you did your English, right?
Okay.
Yeah. So how do you call it and what is it?
Otitis media is a ear condition,
yes,
and especially affecting the middle ear.
Yeah.
It is a condition that can be caused by either bacterial infection or viral infection. It can occur in both adults and children, so it cuts across different age groups.
So it does not really, maybe it's not only for children or people or people around a certain age?
What is more pronounced is that in children it's more common compared to adults. Because children have low immunity. Yeah. So
when someone comes in, or like a patient comes in, and how do you say that this is otitis media?
A patient, when they come in, it starts with a patient complaint.
Yes. And
this patient will come and they will complain about pain in the ear, and majorly it's so severe that it causes sleepless nights. Sometimes there will be a discharge from the ear.
Yes.
It can even, a patient will present, and because of the ear pain, a patient can even present like I have headache. And these are the key things that this patient will complain. Then from there, you need to examine this patient so that you can differentiate, because yes, the patient can come with ear pain, but it's not necessarily otitis media.
Okay.
Yeah.
And so, what kind of pain, or for the viewers out there, when they see or when they feel which kind of pain should they be now wary? Because you just mentioned that not all pains can be described as being otitis media, right? So, which kind of pain? Do we have a sharp pain, a ringing pain?
One, with the ear, it will come with a ringing pain. There will be that ringy sound in the ear. Yeah. Again, if there is any discharge, basically it will be throbbing pain.
And discharge, do we have any, just any discharge, or just because the ear, we know, or we all know that the ear cleans itself. That is one of the characteristics of the ear. So do we have any discharge that we can be able to see that this is now different from the normal cleaning of the ear?
When you talk about bacterial infection, the discharge is pus. So if you see pus, that's a reason for you to seek medical advice. Yeah. So
moving from that and now getting to the signs and symptoms. So you've talked about the ear and also the pain. Do we have any other signs and symptoms that can be attributed to having otitis media?
Sometimes, because otitis media is affecting the middle ear. Yeah. Someone may be dizzy and they may lose balance. Because if you look at the middle ear, it is part of what controls the balance in human beings.
Yes, true.
Yeah. So that when a patient may come, yes, they have these other symptoms, and in some occasion, this patient will be dizzy. So if patients say they're dizzy, it's also important for you to examine the ear.
In terms of children and adults, we all know that children cannot be able to express themselves as an adult. So as a parent back then, you did mention that also children are at risk or can be able to have these. So as a mother back there, or as a parent back there, what should you look out for in your child?
Okay, because children are not able to express themselves.
Yes.
The key thing they'll present with, or they'll express, is one, they'll be restless.
Yes.
And when a child is restless, as a mother, you need to look for what is causing this child to be restless. And basically, if a child is having a ear pain, they will more often all the way out the pain is. So this is a key thing for a parent to look at. Because this child will not say, maybe my ear is paining, depending on the age. Yeah.
So when we talked about all this, then so what you did mention that also these are caused by bacteria and also virus. But can we also attribute this to other illnesses, maybe cold, flu? Tell us about that.
Initially we talked about these things are related. So a patient, one of the risk factors, or is one of the common cause of otitis media, will be cold and flu, because of the anatomy of the nose and the anatomy of the ear. So a patient with cold and flu, which is majorly caused by viruses, if it's prolonged and if it doesn't resolve and it's not treated, may lead to otitis media.
So you also did mention, thank you very much for that clarification. Moving on, you did mention about the risk factors. So who are more at risk of having these, apart from maybe children? And do we have any risk factors, a certain group that are more at risk of having these, or people who live in a certain way? Do we have that?
Part of the risk factors will be age. And in age, we already say that it's more prone in children than in adults. Another risk factor is the environment where these people are living. One, in children, you find that most children are taken to baby care and at a very tender age. And in the environment they live in, baby care, one, the hair flow in that environment, because of the congestion, it's not just so well. So it's a risk factor. Again, your immune system. If you have low immunity, you're at risk, because you're exposed to so many infections.
Do we have anything to do with maybe infant feeding, the kind of how we feed the children, maybe the bottle?
One, in terms of infant feeding, we encourage our mothers to do exclusive breastfeeding for the first 6 months, because one, this helps build the immunity of this child. Again, the baby positioning when you're feeding them. As mothers, and I believe that when mothers deliver, especially in hospitals, they are told about the positioning. Because if you have the wrong positioning, you're exposing this baby. And it comes as a risk factor, and especially with bottle feeding.
Do we have any complications that may arise from these otitis media in the long run, before we take a break?
One of the complications, and which is very common, is ear loss. That is the first thing that this patient always will present with. Another thing, most of the conditions are acute, which means they are just short-lived. If it's not treated, it may lead to chronic otitis media. That means that now you have to treat it with more complicated treatments. What about delayed speech? Because the ear and also speech are in one way related. What do you have to tell us about that? This one can be a complication, and especially if otitis media is not well managed, and especially for the young children, it can lead to speech delay, or even sometimes, if it's not it complicates. This child may not be able to talk even in the future. So it's something that if a child is having ear infection, it is very important for mothers to seek medical advice.
Thank you very much.